Hello and welcome to the Society with Fatima Shaheen at PTV World. They say that health is wealth, but having said that, in Pakistan, it's unfortunate that it appears at least that this wealth might not be accessible to all. Having said that, in Pakistan, we do see a growing number of cases of obesity coming forward, growing number of cases of maternal mortality rate and infant mortality rate by that virtue too surging high. Then we also see more and more younger people unfortunately suffering from mental health disorders, some even committing suicide. And then of course we can't ignore the very important role of orthopedic health here as well, where we do see more and more people now also complaining of hip and of course bone joint health issues too. How do we see Pakistan and Pakistani's population overall, dealing with their healthcare issues? What are the most pervasive issues that we do see young Pakistanis, older Pakistanis, even Pakistani women coming forward with? This is something upon which we'll be shedding light today. We'll not only be diving into, Pakistan's overall healthcare crisis, but we'll also try and debunk so many myths which might exist regarding health and healthcare generally in Pakistan, that too related to various fields. We'll be talking about the very important initiatives taken by the Pakistani government, which is very focused with regards to making healthcare a national priority, more so with regards to modernizing basic healthcare centers, basic healthcare units, and of course by that virtue making generally healthcare service delivery more accessible and inclusive to all. What has been the viability and effectiveness of all these initiatives, and as a society how can we then make that change towards doing away with so much stigma which might otherwise actually surround diseases, especially diseases which then relate with our mental health generally. This and much more to follow, that too with an extremely pertinent panel. Let me introduce you to my today's panel. My first panelist for today's show is Dr. Noureen Anwar, who is FHMU Incharge in our hospital Lahore, along with working at the Health and Population Department. Assalamu alaikum ji and welcome to the show. Thank you for joining us. Alongside her, I have Dr. Ahsan, who is a consultant orthopedic surgeon. Assalamu alaikum sir and welcome to the show. Thank you for joining us. Via telephone line, we'll be joined by Dr. Sajjad Rafique, who is a consultant pediatrician. Assalamu alaikum sir and welcome to the show. Thank you for joining us. And via telephone line, we'll also be joined by Miss Midhat Zehra, who is a dietitian alongside being a nutritionist too. Assalamu alaikum ji and welcome to the show. Thank you for joining us. Now, before we start the discussion on today's topic, let's have a look at this brief report.
Pakistan is witnessing a growing awareness around health and wellness. Among youth, there is an encouraging shift towards healthier lifestyle with increased focus on fitness and joint care. Government and private sectors are expanding access to healthcare through digital health solutions, bringing essential services closer to both urban and rural population. Immunization programs are being strengthened and awareness about child development is on the rise among parents, ensuring better growth outcomes. Women's reproductive health is gaining attention through education campaigns and male involvement, helping break traditional barriers. Efforts are also being made to address iron deficiency, postpartum care, and maternal mental health through progressive policies and support systems. Pakistan's healthcare landscape is evolving, powered by education, technology, and community engagement, building a healthier and more informed generation.
Welcome back from the break. Madam, I would like to start the conversation with you. Now, we do know that a UN report very clearly suggests that Pakistan is listed to be among the top 4 countries making up half of the global maternal deaths. As somebody who is working in, of course, the population and welfare department, what reasons would you attribute to the same? Do you feel that, this rate, it has been on a surging high because unfortunately a lot of women, that too rural women, they do not have access to quality healthcare, or do you feel it is socio-cultural factors which are actually kicking in, because of which perhaps women might not even feel the need to go out and get, timely medical interventions? So how would you look at this?
Maternal mortality is unfortunately very high, as you quoted the data. These are very certain data, and yes, it's actually interplay of various factors. Like lack of education is the basic factor which is involved in it. Then there is poverty, socioeconomic factors as well. Women cannot even reach the nearest by healthcare facilities available.
And they have to travel very long
Yes,
distances
they
too.
have
So
to.
the infrastructure is a very pertinent issue too.
Yeah, and they are so poor that they cannot even pay the fare to the nearest health facility available. So yes, these are factors involved in maternal mortality, and there are other factors as well, like high parity. A woman is conceiving again and again, and she's not getting proper nutrition that she is needed to have, and she's not getting her supplements properly. She's not getting proper social and physical and mental care as well. This ultimately leads to increased risk of maternal mortality.
Right. And also in this regard, we've also come across so many cases where, women might have access to doctors, but they might have access to male doctors.
Yeah.
So there again, you see the socio-cultural element is something which
Yes.
kicks in.
Which
They might
kicks
not be very comfortable going to male gynecologists that
Yeah.
way. So it's an interplay and I think an interconnection of so many things that we
Yeah.
do need to look at holistically.
Yeah.
I'll come towards you, Dr. Sajjad, and I would want you to then comment on this, leaving on from where Dr. Noureen left. Now, when we do talk about, women's health, reproductive health, and otherwise, what is very important to talk about in this regard is also, of course, children's health too, because a lot of times, these factors, of course, they are very interconnected. It goes without saying, the healthier a mother is, the healthier the baby is too. So, at a very basic level, when we do talk about, various issues which have come at the forefront, because statistics also suggest that 38% of Pakistani children, they actually do suffer from stunted growth and from developmental delays too. How do you feel can, changing feeding practices, that too from an early age, actually help us do away with so many issues of malnutrition and stunted growth? And as a pediatrician yourself, that too a leading one in Pakistan, do you feel that parents and caregivers, they are very cognizant of these issues, of the nutritional deficiencies that the children might suffer from? So how would you look at this issue, and what is the advice that you would want to give to the parents out there in this regard?
This is a very important question that you just asked regarding the stunted growth and development delays in children in Pakistan. Um, Pakistan has got a very alarming figure of 38% of the stunting, according to the UNICEF report, which stated that Pakistan is one of the very few countries now left behind which is having a high incidence of chronic malnutrition and stunting. Now, as you say, the poverty is not the only cause for a chronic malnutrition. The maternal nutrition is directly related to the child malnutrition, including the poor health, frequent incidences of the various diseases that include the gastrointestinal as well as the respiratory diseases, and among all, very inappropriate feeding practices among the children, and that we see a lot in our practice these days, and also especially the care during the early years of life. They all are the other factors which contribute towards the stunted growth or chronic malnutrition. Now, this need to be addressed by a multiple phenomena, multiple factors. Now, the mother nutrition is as important as a child nutrition, because if the mom is healthy, the baby is going to stay much healthier at the time of delivery. And if the mom is aware about the health and nutrition of her own, she can do a very good look after the child in the form of nutrition. The most important determinant is the breastfeed. The earlier years totally depend upon the mother nutrition, and mother nutrition directly goes into the child through the breastfeeding. Once a mother starts breastfeeding a child, and automatically a sense of attachment and bonding started to develop, and where the mom started looking after the child much better way as compared the babies who are formula fed. So if we see the benefits of the breastfeed, it starts not only with nutrition, with bonding, with attachment, and a very good early care, which stand as a very good cornerstone in the early part of life, which lead to an healthy toddler, healthy child, and healthy adults, which will ultimately lead to much more benefits in other part of the society as well.
That's right, sir. But in addition to that, the basic question remains, which is that are mothers out there actually cognizant? Are they well aware of the nutritional deficiencies that the children might suffer from? And why is it so important then, at a very basic level, to educate them about the same? But moving on, I'll come towards you, Miss Midhat, and I would want you to add to this from your own perspective of being a nutritionist. Now, they do say that you are what you eat, and that is extremely true for all of us, because I think if you eat clean, that really shows. If you do not eat clean, that again shows. But looking at generally our dietary preferences and our changing, very fast changing, lifestyles, how do you feel has our diet, how do you feel has our lifestyle then contributed towards, at one end, helping us, steer clear of so many diseases, and at the other end, actually pushing us towards others too? So how would you look at this, and what would your comments be?
The statement that you are what you eat is true to the most of its extent, and the broader health picture of Pakistani population explains it so well. Because the World Health Organization says that Pakistan is facing the triple burden of diseases like infectious diseases, nutritional deficiencies, and non-communicable diseases like diabetes. This burden is actually a result of diet and lifestyle. The sedentary lifestyle practices and empty-calorie diets can add on to the nutritional deficiencies and non-communicable diseases. But I must say that processed food itself is not bad. However, empty-calorie food like juices and chocolates are a bit of a trouble. To manage this burden, you can say that appropriate diet is very important. Like to overcome nutritional deficiency, appropriate dietary regime is very important when Pakistan is highly prevalent in nutritional deficiency for the children under the age of 5. 42% of them are stunted, 17.7% are wasted, and 28.9% are actually underweight. To cater this, appropriate diet is very important. And similarly, to cater the non-communicable diseases like diabetes and obesity, appropriate dietary management is also very important. So yes, you can say that you are what you eat, because in the end, it's your diet that can not only help you prevent certain diseases, but also manage and cater certain diseases.
Right, Ms. Midhat. I'll come towards you, sir, and I would want you to add to this, but of course from your own line of work. Now we are talking about the latest health and fitness trends and the disease burden as we do observe it to be in Pakistan today. I think there has also been a very growing surge of orthopedic issues, that too particularly in the younger generation as well as in the middle-aged generation. And partly, at least in my opinion, this is also because of there being perhaps greater focus being placed towards strength training, towards heavy weightlifting too, because people generally in our society today, they are more aware with regards to how they look and how fit they are, and all that focus is there with regards to bodybuilding and looking good. So when we talk about this with respect to the injury aspect, because we do know that a lot of people who do end up picking up weights just to look good, to be fit, they also end up injuring themselves. What do you feel are the things that they need to keep in mind so as to exercise that too in a safe manner? Because they say it right when they say, sir, that the entire idea of strength training and weightlifting should be smart. It should not be hard and tough per se.
So you rightly said that the exercises must be done in a very safe manner. So what happens is that, for example, you use a treadmill. That surface is not designed to do a lot of exercises. So what happens is that when they do the strength training, they don't do warm-ups. They don't lift the weights appropriately. So all you need to do is proper warm-up and gradually increase the weights.
Right.
Yeah, and do have some rest as well. So all these things, they matter. Now, other injuries which can happen because of the inappropriate use of the gym are you can have rotator cuff tears, you can have tendinitis, you can have back problems, and even ACL injuries that can happen.
Right.
So the bottom line is you must hire a properly trained trainer,
right,
who could guide you what to do and what not to do.
That's right, sir. But sir, in addition to that, I think a question which is often asked, which I would want to put to you, is the fact that a lot of times we see that, some level of discomfort, some level of cramps or muscle soreness, that is considered to be normal because your muscles do end up getting tired to that way. But where do you draw that line of distinction where people should ideally rush towards doctors like yourself to get medical help? Because discomfort as it is should be okay. But what is that level of pain or that lingering issue for which they should ideally, go to doctors like you?
So they say no pain, no gain, but I don't think that's absolutely true when you do exercises. So as you rightly said, that little bit of discomfort is normal. So, but if it is affecting your lifestyle, if it is affecting your work, so you must abandon those exercises and seek help. So that's what it would be.
Right, sir. I'll come back towards you, Dr. Sajjad, and I would want you to add to this. So, when we do talk about, health, I think what is very important to talk about in this regard is a newborn mental health too, which, as we all know, is finally getting recognized at the policy level, because we do know that the Parliamentary Secretary for Health has actually announced that a newborn's mental health will be integrated into Pakistan's national health policy. Now, looking at this from a very practical perspective, yes, we do appreciate that this is something very progressive and perhaps should have been done way ago, way some time back. But moving on, when we do talk about this from a practical viewpoint, sir, how easy or how difficult do you feel will it be to then educate parents and caregivers out there when it comes to ensuring that yes, this is something which is prioritized? Mental health as it is often a very taboo topic in our society, and then taking the discussion further and talking about this from the newborn's mental health perspective, that will be completely separate issue. So how would you look at this practically, and what do you feel should be done so as to timely sensitize parents particularly about the importance of the same?
Yes, it's a very interesting thing to discuss because we as the doctors and pediatrician always focus and encompasses more on the physical health. We always talk about the diseases, we all talk about the prevention from the diseases, but we have never been able to talk to a very important and sensitive topic, which we call as the mental health. How important is the mental health? The mental health of babies and children is very important. It not only describes their well being in terms of their social and emotional development, but it also encompasses the early childhood experiences which are in negative way, can affect their personality in a negative way, and ultimately becoming a child which is more so seeing the society as a negative impact on their personality and behaviors. So, the parents and the caregivers who are engaged in the child health, it is very important that they should be focusing on how good the early childhood development and the early mental health exposure should be given to the children. Now, the important factors that affect a child health includes early negative experiences in the house in the form of some social, in the parental, or in the nearby having a very negative experience in the form of abuse going on around them, in the form of continuously snubbing, continuously having a negative impact, not only at home but also in school, and a more a child engaging into the digital world in the form of that we have previously talked about, the screen and screen related things, the more negative impact it's going to put it on the brain. And this only not only lead to exposure to a much more vulnerability, but it impacts on the developing brain in the more form that ultimately leads to a negativity in a child and ultimately proving a child not to perform so very well in the years to come over. Putting out that pressure, that anxiety on the children not only affect the caregiver, not only affect the child, but it do affects the ultimate outcome. A very important aspect is that if a parent is having some sort of a distress going on in his brain, as we all know, it's a part of society, a lot of things are going on around us. The mental status of a parent is also as important as any other thing. Now, ultimately, if we keep on addressing all these things in a negative way, it can lead to so many disorders, which includes the personality, psychological and psychosocial, not only in the form of anxiety, ADHD, depression, and other mood disorder, but also related to many other negative impact, which need to be addressed very clearly and told to the parents and the child in a very aggressive way.
Indeed, that's very rightly put by yourself, sir, because in this regard, then perhaps we should also equally focus upon having a more preventive approach, for example, in by perhaps investing into mental health screenings, that too of infants and babies too. I'll come towards you, madam, and I would want you to add to this. So we are talking about, the health concerns of different segments of the Pakistani population, but talking about this generally from the mental health care perspective, because a lot of times, we do see that the conversation is inadvertently geared towards physical ailments. Do you not feel that we as a Pakistani society have at least made some strides when it comes to having more open, conversations about mental health? But have they practically translated into some tangible change? We do know that the government has been very geared when it comes to making mental health care services more accessible to the people who are seeking the same. But has this been successful in also perhaps changing the stereotypes which might then surround this very topic too? So how would you comment on this, considering that you are, from the government?
Yes, government has been taking some very important and critical steps regarding mental health awareness, and we have been doing communication strategies. We have changed. We have been doing social behavioral change communications, and recently we have developed adolescent health centers.
Right.
They have expert clinical psychologists on them, and they are sitting in every tertiary care hospitals, in the family health clinics, and not only adolescents but other age groups can also visit them, and they can seek their guidance regarding not just their mental health but also about their reproductive health as well.
Right.
So we have been organizing different seminars at different platforms where we are giving awareness regarding mental health. We are celebrating World Mental Health Day, where we are having walks and we are having all kind of communications regarding mental health and emphasizing on its importance and prioritizing and removing the stigmas.
Right, madam, your point is noted. I'll come towards you, sir, and I would want you to add to this, but more from your own line of work. Now, we do know that mental health is that one issue which then relates with orthopedic diseases per se as well. So where do you at a very basic level see that link between, orthopedic diseases and them being on a rise, and that in turn actually impacting our mental health disease burden too?
Now, two things. One is the mental health and the orthopedics. And you secondly mentioned about the problems in the adolescents and children. So vast majority of my patients, when they come to me, they have joint pains, they have less mobility, they have constant pain, they have been taking painkillers for a long time, and that is reflected on their face. So you can see from a very long distance, oh, she's got arthritis. And the other thing is, patients have that problem for years. So they get depressed, they can't go to marriages, they can't walk, they can't do anything else. So it progressively gets worse. So eventually it comes to a point when they just sit down. And that exaggerates arthritis because of lack of mobility and affects their mental health as well.
So, but it's very unfortunate that we also see that more and more young people now, they are also suffering from orthopedic issues like that of bone issues, like that of joint issues. And then you were telling me that even in babies, this issue of hip dislocation, that is extremely common. So why do you feel is that the case? Do you feel this is something which goes back to what she was earlier saying, that at some level it has to do with the mother's health, and that is something which then impacts the child's health too? Or are there other environmental factors or maybe their lifestyles which are contributing factors to such diseases?
You mentioned DDH, developmental dysplasia of the hip joints. It's quite common conditions. It's common in female firstborn child, and it's easily treatable. If it is diagnosed in the first couple of days, the simple treatment is double nappies. So here it lies the importance of screening and early management. So what happens is many of times these things are not picked. So patient comes at the age of 2, 3, whenever they are not mobilizing. So at that stage, the treatment is entirely different. It's a complex surgery they will need. So importance is that the clinician or the nurse looking after the child should have a higher index of suspicion. They must check every single born child whether there is a hip or not.
Indeed, sir, that's very rightly put by yourself. And I think here what is very important is that parents and caregivers, they need to be equally educated too, so as to be able to timely pick up all these symptoms which might possibly lead towards more dangerous and more serious kind of orthopedic diseases too. I'll come towards you, Ms. Midhat, and I would want you to add to this further. Now, we are talking about the latest health and fitness trends, and I would want you to comment on these, that too from the viewpoint of being a nutritionist. We do see this, growing trend of people opting for keto diets, for detox diets, even for that matter, resorting to weight loss drugs. So as a dietitian and as a nutritionist out there, how would you then not only comment on the advantages of using the same, but equally on the disadvantages, perhaps the dangers of using all these things, that too repetitively long term? How would you then advise people to use these, but perhaps do it in a way which is then well monitored by medical healthcare professionals? Because we do also appreciate the fact that perhaps using of weight loss drugs like the Ozempic, for example, might lead to not one, rather quite a few diseases long term. The research on this issue is still not very clear. So how would you view this?
The idea of achieving zero figure through rapid weight loss is the pioneer of crash diet these days. Talking about the keto diet, it is actually a high fat, low carbohydrate diet. You see, in your normal diet, there is a ratio of 45 to 65% of carbohydrate and 25 to 35% of fat. And in keto diet, you disturb this ratio to get maximum of fat and minimum of carbohydrate. So the long-term use can cause the deficiency of certain vitamins, and it is actually a fiber deficient diet. So I've seen so many people taking laxatives and multivitamins, which is actually not recommended. I recommend you to take a maintained diet rather than a keto diet. Talking about the detox diet, it is actually fooling people because your body has its own detox system. It does not need any detox water, tea or juice. They are practically of no use. There are certain drugs like Ozempic that actually are being used these days for weight loss. It is actually FDA approved drug that was being designed for type 2 diabetics because it delays the gastric emptying. But in weight loss journey, people use this drug because delayed gastric emptying can reduce the appetite. But as soon as they stop using this drug, their weight can rebound. So it is actually not recommended to use Ozempic. There's another problem of bad eating rhythms in young population, like emotional and binge eating in youth, which is actually a result of loneliness, a cope-up mechanism to the failure, or maybe a source of enjoyment, because the youth mostly binge eat on high calorie, low nutrient foods, which can help release dopamine to boost their mood. And in late night snacking is actually another form of binge eating that is seen in young people who mostly stay up all night. I met a patient like last year, and he said that he gained 10 kgs in his night shift because he reported that he snacks on crackers, chips and chocolates during his duty hours. So staying up late at night can be a cause of binge eating in young people that needs to be addressed as soon as possible.
Right, Ms. Midhat, your point is noted. I'll come towards you, Dr. Noureen. I would want you to add to this further. So we are talking about, various issues which are then faced by different segments of the Pakistani society. I think in this regard, something that we do need to focus upon is the growing issue of overpopulation. Of course, the need for us to ensure that women in Pakistan, they do get access to quality family planning, initiatives too by that way. Now, in this regard, I would want to quote the statistics of a report which suggests that contraceptive use in Pakistan is still low at 35%, with millions of women lacking access to family planning methods. And then we also know that because of the growing ratio of child marriages, there's a higher rate of teenage pregnancies coming forward too. So what efforts are being made to overall improve women's access to family planning methods? And is the government also working to do away with so many socio-cultural impediments which might come in people's way so as to even access, family planning per se, because this is, as we understand, a taboo topic in our society.
Government has been taking very serious steps regarding the constant contraceptive supply at all our service delivery outlets, and not just on service delivery outlets. We also been giving services in underserved areas, in grey areas, in rural peripheral areas where there are no other services are available. We have been conducting mobile service unit camps with expert staff. A doctor accompanies that camp, and we have been doing procedures over there, like we are giving temporary and permanent methods available there. Similarly, we are also giving awareness lectures over there, and we have also digitalized our awareness campaigns. Like we have an app which all of you can download from the Play Store, which is Khushi Ki Baat. It's actually a very good app. You can get all the information regarding temporary and permanent methods of family planning, and you can ask queries even regarding your myths associated with it, regarding any information of side effects. You can also have informative material on this app, and you can also know about the nearest family planning facility available.
But in addition to that, I feel that, this conversation might be incomplete if we don't talk about the pervasive issue of male infertility. Now, we do know that statistically, at least in Pakistan, that 40 to 50% cases of infertility are attributed towards males too. But as a society, perhaps you might not be very open in talking about the same. So, is this an issue which has then been addressed by the government, especially when it comes to doing away with the gender bias which might surround male infertility in our society?
Actually, all of the questions regarding family planning, they revolve around SBCC, which is social behavioral change communication. So this is all about awareness. This is all about lack of education. So we are working on it. We are already been running several campaigns on different platforms. We are covering like radio podcasts. We have been doing several TV programs. We have been doing commercials. We have been doing short video messages regarding awareness on male infertility and how men play role in family planning and in health of women as well.
Definitely, Doc Saiba, and it's only fair to then take, of course, both genders along, especially when we do talk about, issues like these. I'll come towards you, sir, and I want you to add to this. And now, a very pressing, a very important concern in the Pakistani society, which has become very rampant, is that of growing obesity. And obesity, as we all understand, is something which then, amongst other things, also impacts one's orthopedic health too, their joint health, their bone health overall. So, as an orthopedic surgeon, sir, how do you then can people look into, of course, reducing weight by exercising, but then again doing it in a manner which is then not adversely impacting their joint and their bone health? Because you see, there is a conflict of interest there. People who are obese, who are overweight, it will be more difficult for them to exercise, and in the event that they do end up exercising, there might be a greater chance of them injuring themselves. So how do you propose can they find that balance?
Human body is a physical body. Simple laws of physics apply to the human body. If you have high BMI, you're going to damage your knee joints and hip joints much quicker than that. It's quite obvious. Now, it's a vicious circle. If you can't reduce your weight, you can't get healthy joints. And even if you get a joint replacement, with high BMI, you are going to wear it quite soon.
Right.
Simply, you on a small car, if you put a weight of a truck, you're going to wear the tires very quickly, in very simple words. Now, high BMI, obesity, it's very, very important to treat it. Now, what happens is that when you tell the patients to walk, reduce weight, get a nutrition help, problem is they can't do it.
Exactly. That's why I put this question to you.
Yeah. So ground reality is, I rarely come across patients who have actually lost weight once they have developed arthritis. So they are in a very bad situation. So now, on the other side, when the joint does not move, it gets worse very quickly. So it's very important that don't wait for the weight to be worse. You have to address it now. So when you are young, be active. And the other thing I would like to say at this stage is in the childhood obesity.
Right.
So the teenage high BMI patients, I have a lot of concerns for them too. Their bones are not looking good. So it's very important for the children to be active and involved in sports. So parents, teachers, they must take responsibility to let the children play.
Right.
And the other thing I would raise the concerns is the fast food. Children nowadays, they are not taking healthy, cooked, hot food. Instead, they would order online and they are kind of
Right.
used
I think
to
the
it.
entire lifestyle and that mindset towards eating, that needs to change, and that needs to be inculcated into children at a very young age. Perhaps maybe have a curriculum which focuses on healthy eating per se, because this is something that we do see happening in other parts of the world too, sir. But I'll come towards you, Dr. Sajjad, and I would want you to add to this. We are talking about children's health, and an issue which is often raised, which I would want you to address, is the fact that that we often see more and more, Pakistani couples perhaps being in that habit of over medicating their children, the young children particularly, giving them perhaps too many antibiotics. So, as a consultant pediatrician, sir, how would you then warn against the dangers of doing that? And why do you feel is it so important to take a more conservative approach when it comes to treating younger children, such that at a very basic level we do let their immunity develop that too naturally?
Yes, a very interesting question you just asked. Um, Now, I just like to clarify very few things that most of the infection that happen in the children and even in adults are viral, by which I mean that it does not require antibiotic or even the treatment at any time. The body immunity is self-sufficient enough to handle most of these infections on their own, and sometimes all what requires a symptomatic treatment just for the fever control in the form of paracetamol. The cold and infections, generally speaking, does not require any medication for that because they are generally the self-limiting illnesses. But if at all it is required, these are the very mild medication that is needed. I absolutely agree, and there are now plentiful of studies that has done and tell us that frequent use of antibiotics and medication do affect the immune system and making it a more weak, and reliance on those medication does not make a body dependent upon those things, but it do affect the immunity and will impact the natural course of the immunity, which ultimately lead to fixation of so many things. So I absolutely agree that a lot of medications are not recommended for children, and if needed, that has to be decision of the doctor. And unjudicious use of antibiotic is as cruel as any other thing, especially in the children at a very young early age, because it has been associated with these sort of a delayed response to immunities and affect the body in a very negative way.
Right, sir, your point is noted. I'll come towards you, madam, and moving towards the end of the show. So, my last question to you before we conclude today's show is the fact that how do you, as a doctor in your own right, then propose can we work towards prioritizing women's health, whether it is reproductive health or whether it is their health otherwise, that too in a way that it is given equal priority as compared to men? Now, a lot of times we do see that even if women end up falling sick, they might not be given the same level of importance, or they might not be given the same level of attention as might be the case compared to their male counterparts. So what are those societal shifts and mindsets that we do need to change in our society so as to generally prioritize women's health, that too given our socio-cultural dynamics?
Women's health should be prioritized, of course. There are many stigmas associated, like with breast cancer awareness and with other diseases like cervical cancer has been increasing very in Pakistan.
Ovarian cancer
Ovarian
too.
cancer is increasing also. So there are other adolescent health issues as well, like early menarche. Now a girl at 9 is having menstruation. Even the issues associated with the menopause. So basically we need to educate in these areas as well, and we need to make men in these education strategies and in these communication strategies so that they can know about these problems as well, and we can minimize the stigmas associated with these problems.
We definitely do need to make men very important allies when it comes to advocating for women's health, that too generally in Pakistan. I'll come towards you, sir, and moving towards the end of the show. So my last question to you would be that, having spoken at length about not one, rather quite a few orthopedic issues that people generally face in Pakistan, how do you feel can we work towards number one, early intervention, and number two, having more of a preventive mode as opposed to a reactionary one, focusing on prevention as opposed to treating something when it has happened, because they say it right when they say that prevention is definitely better than cure.
So basically all you can do is prevention is definitely better than cure, and early detection is important. For example, if you maintain when you are in teens or middle ages, that is the time when you will prevent your arthritis and your long-term issues. There are certainly
or those knee replacement issues which have become so common in Pakistan, especially amongst the elderly population, women particularly.
Yeah. So talking about the knee replacements, a vast majority of my patients, they are females. Nearly 70% of my, are the females, and the reason is only lack of physical activity. When I ask them, when was the last time you walked 1 kilometer, and the answer is no. So simple. There's one take-home message: moving joints are healthy joints. And you can do any activity. I never stop any patient from doing stairs or walk or doing your prayers fully. All these things are healthy things, which unfortunately over the years we're not doing it.
Right.
The other thing is, ladies, when I ask them what kind of activities they or walk they do, they say we do a lot of activities at home, but actually that's not helping.
Enough, sir.
So all you need to do is get out of home, have a regular walk, little bit of exercise, and that's the only thing. Simple things.
Right,
that
and we need to start doing this at an earlier age, because you know, they say it right when they say that the kind of lifestyle you have in your 30s and in your 40s is something that will actually dictate the way you will be in your 70s and in your 80s. So
Yeah.
I think that entire focus on self-care and self-love in our society, more particularly for women, that completely needs to change, and it's high time that it so changes. I'll come towards you, Dr. Sajjad, and moving towards the end of the show, my last question to you would be that, you know, when we do talk about children's health, a very important concern that we must address in this regard is also that of, growing heat waves, is also that of growing air pollution, and of course, climate change per se. So how do you feel can concerns like these then be given equal consideration, that too in a way that, you know, our policies, our general practices, they are very cognizant of all these issues, especially when it comes to ensuring that yes, they do not impact children's health adversely. So sir, how would you look at this as a pediatrician, and what would your recommendations be with regards to overall improving children's health, given, you know, of course, the environmental factors that we are generally faced with?
Yes, absolutely right. This is a lot of problem that we are seeing in relating to the air quality and the respiratory illnesses in the children. The children are much smaller than the adults, and because of their body and because of their normal mechanisms, they tend to take a lot of these pollutants into their lungs, which is not only developed but also the developing lungs, and it tend to produce a lot of negative impact, not for the time being, but also for the long term negative impact on the lungs in the form of a lot of asthma is being diagnosed and managed. A lot of other respiratory illnesses are also what we are seeing these days getting into these children. Now, you can't stop a child going from outside, but my suggestion to the parents is that the most important thing is when you feel that the air pollution levels are quite high, try to keep the children indoor as much as possible so that they can have at least some good quality air going into their lungs, especially when those are the worst days. Now in Lahore, what we're seeing is there is a variation coming, different parts of the month have got a different AQI level, but especially in the smog season, the respiratory illnesses can be minimized by keeping the children as much as possible into their indoor activities. Try to give them as much clean air as possible, protecting the lungs from going into the trouble by using masks and things like that. But no, it's not so simple thing for me to tell, and not so simple thing for the parents to get hold of. This requires a very careful and meticulous control, not by the parents, but also by we have to have some advocacy for the better policies, better planning, so that we can try to give as much clean air as possible to our children and try to minimize the problems. Other than that, giving a careful, healthy environment, prevention from the illnesses, looking after their mental health, looking after their physical health, it's all very important. Now, the mental health is not only related to the parents' mental health and the parents' surroundings, but also into the environment where they're going to go after. Talk to your child, talk to your children appropriate to their age, try to understand their problems, try to manage them, and also at the same time work hard on the personality development and grooming in a way so they should be a useful member of the society.
Right, sir, your point is noted. I'll come towards you, Ms. Midhat, and moving towards the end of the show. My last question to you before we conclude today's show would be that when it comes to, you know, changing our healthcare perspectives, when it comes to changing our societal attitudes, and also perhaps our policies at some level, what do you feel are the interventions that we do need to actively prioritize so as to make nutritional deficiencies, nutritional campaigns, and education about the same a priority, how do you feel can we then go about educating people out there, that too perhaps focusing more on the quality of nutrients that people actually take as opposed to the quantity of nutrients? And then, of course, by that virtue, why is it so important that this is something that is done holistically? A certain amount of responsibility is also put on food businesses. So how would you look at this, and what would your recommendations be in this regard?
Obesity is no longer an urban problem. It is actually a public health concern now. Because 58% of the adults in Pakistan are overweight and obese, and obesity is a risk factor for hypertension, heart diseases, and type 2 diabetes. So, I must say that obesity is being driven by poor dietary choices, sedentary lifestyles, and lack of nutrition related knowledge. I would like to say that to manage obesity at public level, the focus should be on quality of nutrients and not only the quantity of calories. Because you see, it is not possible for the illiterate segment of your population to keep the track of calories. But food quality and balance can be achieved through the idea of portion control and my plate. Talking about the concept of my plate, consider a plate and fill the half of your plate with fruits and vegetables, 1 by 4th with whole grains like chapati or brown rice, 1 by 4th with the lean protein like fish or chicken, and keep small quantity of dairy alongside. Now, how to implement this idea? I must say you should implement this on grassroots level, like in the form of school programs where you can provide the visual implementation of my plate and healthy eating so that children can adopt this idea for the rest of their lives. The government can train the lady healthcare workers to teach women and mothers about healthy eating and my plate so the women can take care of their families in that way. Making use of media campaigns and social media influencers can be a very good idea. And there's one important thing that I need to mention is food label reading, because most people do not have awareness about this, and it must be promoted because the end user should know the nutrient quality and nutrient quantity in order to cater obesity. In the end, I would like to say that community engagement at every level is very important to make this idea workable.
Right, Ms. Midhat. On which note, I would like to conclude today's show. Thank you so much, Dr. Saiba. Thank you so much, Dr. Ahsan. Thank you so much, Dr. Sajjad. And thank you so much, Ms. Midhat, for your time today. Well, to conclude today's show, we generally spoke about the latest health and fitness trends as they do stand in the Pakistani society. In this regard, we spoke about not one, rather quite a few pervasive issues that different facets of the Pakistani population are then faced with. Of course, proposing solutions to the same as well. It goes without saying that we do see the Pakistani government working very diligently so as to prioritize people's healthcare and overall working to improve people's accessibility to the healthcare system. But we also do need to work upon is ensuring that people do get quality healthcare access in that regard too. We also need to ensure that our healthcare is something which is equally inclusive of all. And last but not the least, when we do talk about physical ailments, whether those which then relate to reproductive health, whether those which then relate with orthopedic issues, or for that matter even nutritional deficiencies, what we cannot ignore in this regard is of course mental health too. Mental health generally in our society needs to be given equal importance as is physical health per se. Thank you for watching The Society. Until next time, take care and Allah Hafiz.